So, thank you for joining us at the end of the seventh annual Black Maternal Health Week. And I just want to point out that this week was founded by Black Mamas Matter Alliance. And their goal is to amplify the voices of Black mothers, bringing visibility to Black led maternal health initiatives, and centering the values and traditions of the reproductive and birth justice movements. So I'm going to take this time to shine some light on the experiences of Black women during their birthing journeys and the need for quality, multifaceted, trauma-informed services. So research indicates that 22% of Black women receive lower quality of care than white women and are subject to discrimination in the healthcare field. 20% of women report experiences of mistreatment during maternity care. And as a Black woman and mother who has given birth 3 times, I know what it feels like to be ignored and not believed and mistreated by our healthcare system. 29 weeks pregnant, I was hospitalized for preterm labor. And after 3 days, I was being discharged, even though I was still feeling extreme pain. I voiced this a number of times and I was discharged anyway. I was home for 3 hours when the pain intensified and I was back at the hospital. I remember walking into the emergency room and someone saying, "She was just discharged. She's not in labor." I was taken into a room because I was unable to stand, I was unable to sit, I was in so much pain, and I was told to calm down and to put on my gown. I could not put on a gown because I was in too much pain, and my mom helped me to take my pants off. The doctor said to me, not even acknowledging me, "You were just discharged. I don't think you're in labor." So his goal was to check to see how much I had dilated, and he was met by my son's head. So I gave birth. In my t-shirt at 29 weeks. My baby weighed 2 pounds, 9 ounces. I didn't hear him cry because he wasn't breathing. And as they worked on him, I prayed to God that he would live. And he did. But we know that that is not the case for many. Oh goodness, I've lost my place. Hold on. We know that so many babies don't survive. Preterm birth is the leading cause of infant morbidity and mortality in the United States. Despite advances in medical care, racial and ethnic disparities associated with preterm birth persist. According to the CDC, the rate of preterm birth among African American women is about 50% higher than the rate of preterm birth among white or Hispanic women. And we're here because it's Black Maternal Health Week, right? But this isn't an issue, it's not an issue that we can just talk about or address during a week or a month. This is something that should be a priority, and we should always be working and strategizing to improve outcomes. And by the end of this press conference, you'll hear more about what we'll be doing here at the legislature. So we have passed legislation like the doula bill, which Rep. Porter will talk more about. And we have a bill this session that seeks to license certified clinical lactation consultants. And we know that breastfeeding is protective of maternal and infant health across the life course. And this bill will enhance accessibility to families who really need it. Increasing breastfeeding rates in Black communities is an important public health strategy to address maternal and infant mortality and morbidity. We need this bill to pass. And before I end, I want to say that this may seem complicated to some, but for me, it's quite simple. We want to be seen and not ignored. We want to be heard and not dismissed. We want to be believed and not doubted. And we need and deserve to have quality providers who provide quality care. Giving birth should be one of the most natural and joyful, precious times of our lives, and we just want to live through it.